Good afternoon, ladies and gentlemen. I am super glad and excited to be here today in the third episode of Entourage Talk. Allow me at the beginning to thank you all for the support and the overwhelming responses I have got over the past few episodes of Entourage Talks. Today, I will be touching up on a very important topic which we have been hearing from everyone talking about for the past 3 months. The world is changing after COVID-19. What does that mean and how this is going to materialize over industries? And we have seen a lot of announcements from different sectors announcing their shifts into the digital era. Healthcare is the most prominent sector right now, followed closely by transport and logistics. That's why I have decided to dedicate this episode of Entourage Talks to speak to the experts in these two fields and try to understand the digital transformation over these two sectors. I am honored today to have with me Miss Carolin Neubauer, and she is the head of business development MEA and Pakistan at Uber. Good afternoon, Carolin.
Hi, nice to meet you all.
Thank you for being with us. As well, I have the pleasure to welcome Mr. Mark Nichols, who is the head of Strategic Initiatives for the MENA region in the World Health Innovation Summit. Hi, Mark. Good afternoon.
Good afternoon, Mohammed. Thank you. Thank you for inviting me. Thank you for listening.
Thank you both for accepting the invitation, giving me the pleasure to be your host today to talk about a very exciting and interesting topic, especially everyone in the world, not only in our region, is talking about nowadays. Life post-COVID-19, business post-COVID-19. I believe we have heavy topics to talk about today, especially that both of you are coming from the most prominent industries in this part of our life, especially within what happened from the COVID-19. So how business are going to change and adapt after COVID-19? Also, being part of these two leading industries, transport and healthcare both together, what are the changes you are expecting to see? And I have this question for both of you. I think, Caroline, if you would like to start, then I will move into Mark with the same question.
Thank you very much. I feel from the transport sector, what we have seen as a trend, so we are digitally set up already, but one of the big elements that came to land is like, how can we further serve the transport sector and the B2B transport sector? Which means for us looking at new business models, which means looking for us as, okay, is there any way that we can give our drivers, for example, extra opportunities in times where maybe person transport is not the biggest way of transporting because we're all trying to stay home and we all have the same rules or indications of rules all over the world. So really taking a detailed look at saying, okay, we have this reach of, on the one side, customers, we have this reach on drivers, we have an availability of vehicles that our drivers have access to, and then taking a look at the industry and saying, like, where is there potentially a need that we can fulfill in a very short notice? So the opportunity at looking customer requirements changing in this environment has definitely been a great learning for us and using the tools that we had available. So one of the things that we recently did was working together with a company like Amazon, saying like, okay, we are aware that people are not really in the retail sector at the moment. What can we do as we identified there is a bottleneck in bringing the goods from the warehouses to the individuals at home because e-commerce has been going through the roof. And then seeing how the two tech giants can work together on a solution and kind of implement it on a very fast level. So that is definitely something where we see the change in also the way we're thinking about, but also staying open to new solutions and also staying open to solutions we had in the market already. So one of the things that was interesting for us was we used to have a product which was called Uber Rush many years back. It didn't work at that stage because the environment was very different. So we actually chose to discontinue it. We have brought that product now with adjusted product features and now bringing it in, and it's a great success. So I believe
transportation tech, today you're trying to adapt We will talk about the future now, and we'll talk about the new products of Uber now. But I want as well to hear from Mark about the same. How do you see the healthcare will be after the COVID-19, and how healthcare performed over COVID-19, especially that I believe the healthcare sector was the only sector performing well over the past few months.
Well, I think if you read the press, the common press, it all looks like bad news, right? We have challenging times. The social media, if you read everything, it looks like that we're living in horrible times. I honestly believe we're living the best times in human history. Really, the developments of the changes, the technology developments we see are phenomenal. And you put that on top of the exponential growth we're seeing across all the sectors. I mean, it's going from building blocks to hockey stick returns. And we're seeing that on implementation. We're seeing that from the government policies. We're seeing that from the hospital partners. We're seeing that from, most importantly, the people. I mean, you see the willingness of adaptation for telemedicine, for digital solutions. So, I mean, we've seen, again, exponential growth. If I try to explain in just context what we're talking about is, if you look at the future, literally, you're looking at 30 steps forward, and you go 30 steps forward, you're now 30 meters ahead. But if you look at it exponentially, which is just doubling it essentially, you go 30 steps forward, and that's a billion steps. That's a billion meters forward, and that's what we're looking at right now across the sectors. So telemedicine has been around for 5-7 years. You know, it's been mildly accepted, but now it's up, 3,000% in terms of the growth. We're seeing great solutions coming out of the States, coming out of the UK, that have actually clinically proven data that's being accepted by the insurance payers. So they're actually recognize it. I just saw a report this morning that McKinsey's reporting that there's going to be 250 billion spent in the next year in the US on telehealth.
Can we repeat the figure again, Mark?
250 billion in the US on telehealth, just on telehealth.
Wow.
So, I mean, what this means for me, I'm finding what's really interesting is I've been doing business in the Gulf since '98, and I find the response has been very proactive. The government officials, the leaders have been fantastic in terms of responsive, and I think they honestly really want to work with the people and the benefit the populations. So we're seeing that. We're seeing the health agencies, the Ministry of Health and Department of Health, all coming and really being responsive and looking at new solutions and implementations. And then you have the hospital partners and providers. They're all very, very open to doing collaborations and partnerships. And I think the challenge is just identifying those that have clinically proven data that are adaptable for the region. And on top of that is that it's scalable for the population, I mean, perfect example, there's one that we're talking to in New York. I like the team very much. They've been successful in New York and the States. They've got backing from American Health Association and whatnot, but they're already in Egypt. Their facility, their platform translates in 72 languages. So that in itself is a huge edge that we can bring, and we can partner with local, facilities in the UAE and in Saudi and grow that out. So I could go on forever, but
We will talk about the new technologies and the new businesses within the healthcare technology in a bit. I just want to move and to Caroline, or to go back to Caroline and talk about the Uber Medics, which has been launched recently, I think yesterday or a few days back. Is this an indication from Uber that Uber is going to expand into the healthcare sector? I understand that Uber Medics is just a highlight to appreciate the importance of the healthcare workers who the current situation and giving them discount on the rides. But is this an indication from Uber that, yes, guys, we are there and we're looking seriously at the healthcare and we are willing to change it as we did to the transportation field?
Well, for us, we always are customer centric, and we move what matters, right? Yeah. And when we look at what matters now, the healthcare sector is a very key sector to this environment we're finding ourselves in. I wouldn't say that we say like we want to go into the healthcare sector, but we know we have a product that is very valuable to the current situation because we have the flexibility and we have the ability to fast adopt on what market needs are. And that can be on the one side, where we're serving nurses, where we're serving hospitals in order to kind of free up hospital beds for the new situation so they can do some home care or do home care for patients. That can also be certain elements where we looked at, okay, there is a need for delivering pharmacy products at home and presenting that to the ministries and working with the ministries as well as like the Abu Dhabi Welfare Fund, Mubadala. We see a lot of response on it. And if there is a way we can help and support, obviously we do that.
Excellent. So, Mark, let's go back to let's go to the basics immediately, and let's talk about the digital transformation in the healthcare sector. And I believe you are the expert in this topic, especially that you're coming with an intensive background about digital transformation, especially over the healthcare sector. So, how do you see that digital transformation will be taking the sector of healthcare at large, or our region healthcare sector, especially GCC and the region of MENA at large?
Well, I see making GCC as the leader, the digital leader, not only for the region, but I see them because they're so proactive that it could be globally. But so GCC, but going to the MENA, if you include Pakistan and Turkey, you're talking 700 million people, which is 10% of the global population. I mean, that's phenomenal. And you have 200 nationalities in the Emirates, which is, so the clinical data, it's almost like a petri dish in terms of what you can achieve. So in terms of like real implementation, let's talk about NCDs, non-communicable diseases, right? I mean, we're talking diabetes, we're talking cancer, we're talking heart disease. These are all only, firstly, it's rampant in the Gulf. So Saudi and UAE have 25% diabetes issue, right? So 41 million people globally die from NCDs. But the good news is this is all very preventable. I mean, this is not, it's reversible. I mean, I've seen some technologies where it's simply as a wearable technology where you could have grandma wearing an Apple Watch and simply, monitoring her, or not only her blood pressure, glucose, and everything like that, but she can go on with her daily life. And she could be, it could be a rural setting. It doesn't matter. It reports clinically, it reports it to her data, to her physician and her clinician. And this can be monitored on an ongoing basis. And not only that, it's recognized now as from the insurance companies on the payer side as sensible. It's cost efficient, it's effective. And I mean, we have an opportunity now. We've doubled, in the past 100 years, we've doubled the life expectancy from 40 to 85 actually. But we have the opportunity, especially now, to put on 20, 30 years onto our life, and only by just making small changes in our life. And this all come back to the digital technology. Don't even get me started in terms of the biotech side. It's phenomenal. I think it's fantastic. I mean, I think the thing is, what you want to deal with is everybody's talking about clinical data. So I've seen some data in terms of Tesla, but I'm saying in terms of if you can use to Uber medics and things like that, especially rural areas, that's fantastic. The more you can access those areas, it works out very well. And like you're saying, delivery on pharmacy goods, sensible stuff. I mean, there's no reason. I don't even think we've fathomed it.
Sheikh Mohammed bin Zayed, the other day, he was on a live broadcast with the healthcare sector of UAE, and he appreciated all the efforts of these people, the people who we are calling the first defenders. And he spoke highly about the capabilities and the readiness of the healthcare sector of UAE. Do you think we will see major change for the healthcare sector in UAE, Abu Dhabi in specific, or UAE at large? And do you think this UAE will be leading the region in the digital transformation when it comes to the healthcare sector?
Is that for me? I see. Seriously, I think we're living in game-changing times right now. We're changing in human history. If I again talk about exponential growth, I mean, if you talk about Moore's law, everyone kind of knows that, which is computer speed, which typically says it doubles every 2 years. So simply your microprocessing doubles because the transistor size gets on, microprocessing doubles every year. That's not the interesting bit. The interesting bit is in AI technology, because of quantum computing, it's doubling every 3 to 6 months. So a guy in Cairo can buy a smartphone and have the same technology, the $1 billion technology that Elon Musk has. And so to say, will it change? Fantastic. I think we can't even fathom what we're going to see in the next 5-7 years. You got 3.8 billion people connected right now everywhere in the world. That's supposed to go to another 4.2 billion, up to 8 billion in the next 10 years. All of them having $1 billion technology in their hand. So I think telemedicine is just the tip of the iceberg, going from the individual all the way up to the hospitals, where you're having IoT implemented for cost-efficient administration. Medical tourism, that's a big business. Medical tourism itself. In Abu Dhabi, the Emirates in general, and Saudi, it's a $50 billion business per year. It's growing at 15 to 25% before COVID. So you imagine after COVID, what's going to happen? It's going to just skyrocket.
Absolutely. Caroline, we have seen during the past few months a lot of Uber, especially the logistics side of Uber. I mean the Uber Eats before the announcement. We have seen a lot of deliveries. So do you think these 3 months was one of the most important months of operation for Uber, especially Uber Eats, before the announcement of shutting down?
Certainly. I mean, the delivery market is changing significantly because mobility of people is low at the moment. I think it was a good decision in terms of like consolidating it with Careem Eats, just in order to bring forces together. But it was a quite significant change in having an opportunity to see the growth figures, but also see customer behavior change. And some of the trends are lasting. When we look at grocery deliveries, when we look at pharmacy deliveries, I think these trends will stay. And when we talk about groceries, we talk about home cooking, we talk about people, taking more care of themselves. So I think the COVID period has also brought to us that we want to watch our immune system more. We want to know what we have in our food. And some of these trends also reflect then in what type of goods and groceries people order online. One thing what I wanted to add to Mark's point, where, talking about how exponentially it's growing, I also feel a beautiful example of what is possible today is like the open source research that happened on COVID, and the way information was shared, and the way the world worked together in order to kind of work on the vaccine. And that would have just not been possible. And these type of innovations, or these type of changes of ways of working together, obviously going to contribute exponentially to the growth of knowledge in the world. Yeah.
Very good point. Everyone knows the story of Oxford Sciences doing the deal with AstraZeneca, and that was open source. I mean, that's, I spoke to them about it. It was open source project, and now it's going live. I mean, that's fantastic in terms of that happened. Think about that. That happened in 3 to 4 months. I mean, went from just a concept to clinical testing, and now we're coming up with a vaccine. So I think this is just the tip of the iceberg what we can do. Something I failed to mention too is on the funding side. Sustainable investing, which is basically responsible social investing, has been around for 10 years, and it's been growing steadily, but it's not caught a lot of traction. Since COVID started, this past quarter, 45 billion in assets have gone into sustainable investing. People are coming around to sustainable investing. On top of that, BlackRock announced a deal 2 weeks ago to sell a large stake of BlackRock, the largest asset manager in the world, to the Saudis, to the sovereign wealth funds. So the reason being is BlackRock are great believers in the region, and on top of that, they estimate 300 billion in growth in sustainable investments over the next 5 years.
For you, Mike, if I am, or if we have an investor watching us today, and he wants to invest in the healthcare sector, what do you recommend for him? In which field within the healthcare sector we should be focusing on?
Well, I mean, it depends on your appetite, but I would say certainly telemedicine, the right telemedicine, because there's some great projects out there that we've seen. There's one I'm speaking to I think the CEO is probably listening, is Vital Tech out of Texas. They're doing fantastically. They're backed. They have they're approved by AT&T, so they're selling very well, and they're already in the region. So I think they're doing fantastic what they're doing on the telemedicine side and their platform. On top of that is biotech, which is basically gene sequencing. Gene sequencing has gone down from $100 million cost to under $1,000, and there's some fantastic projects coming out of San Francisco on that side of it. So we're talking about where you can look at your biomarkers and look at everything from your proclivity for cancer up to your lactose intolerant, up to the color of your eyes. But you can do that. You can literally walk in and make an appointment today, and it's I think it's under $1,000 for the appointment. But you get all your biomarkers, and you could substantially add to your life. There's companies like this that are coming out that are just going to, again, it's $1 trillion industry. I mean, I'm probably underestimating it and growing.
Caroline, back to the point which you touched at the very beginning, at the very first of the conversation, that Uber is expanding and you're going into maybe several new products, or maybe bringing back some of the old products. So how do you see the future outlook, especially in the Gulf region, maybe at large in the world, if you want to talk about the world, especially that you are managing the region of MENA and Pakistan. So I think you have 700 million people of outlook. How do you see the digital transformation in this field, and how quick do you see these technologies will be developing?
Well, I believe it's about reaching the customer. And I mean, it's hard to say how fast it will be developed, but certainly the willingness to adapt new tools is very different than it used to be.
Yeah.
I think also psychologically, there is a vacuum what we have at the moment where people say, oh, the environment is so different. I have an excuse in case it fails, which actually makes us braver to adopt new ways. And also as companies and corporations, makes us significantly braver to give it a try, as it's sort of a special environment. And I think that is certainly helping on that side.
Absolutely true.
Something has nothing to do with this discussion. We have mentioned customer experience. I'm not sure if you can, Caroline, tell us about if today any business owner, any person who wants to shift his business today into the online business or to the e-commerce business, he needs to take into consideration the e-commerce journey and e-commerce journey into consideration. Do you want to talk about the importance of customer journey and how a proper business should be taking care of the customer journey from start into end?
Yes, certainly. I mean, I believe when we're looking at the customer journey, it's always about reduction of friction. And that is what keeps us on our toes on a regular basis, right? So very often when we talk about taking a digital journey, people start with, okay, we need to design an app. But what it's really about is really trying to understand what is the customer looking for, but also long-term, what does it mean, and how do we keep this app and as frictionless as possible in order to serve the customer? And that is where the real resources go. And that is where the real investments also go from, like human resources as well as capital investments. On the e-commerce side, I believe, look, I mean, there's two things to it. There's also obviously the customer experience from what does the customer want, how, but that also leads to the operational excellence and to the operational efficiency. This is something where quite a few, at least in the region, and I believe also globally, quite a few of the e-commerce players have been struggling right now because they outgrew themselves due to the change in demand overnight, due to the changing environment. So there is really, you could see the difference on who was able to adopt fast in order to increase their ability to process capacity, and who was willing to try new methods of moving things around, and other players weren't really able. And there is still e-commerce players that have a backlog of, honestly, of months for certain products. And I'm not sure if we all have probably tried to order certain things on Amazon as we're trying new things also during the COVID period. There is certain players that are still not able to deliver, although these guys, I believe, are on the right track, but some of the smaller players are still struggling.
Talking about the digital transformation over sectors, In the last episode, I spoke about our experience in trying to transform a very traditional way of business into the digital world, and I spoke about the virtual event application which we are introducing to the market very soon. And this is an example by itself. We have never ever thought about attending an event on the virtual world. Especially the event requires a lot of interaction, a lot of personal human touch in it. Eve today will be launched very soon by beginning of July. It is a proven example of transforming traditional business into the virtual world, into the new digital transformation. I want as well to stay with you, Caroline, and to talk about the products which you think, or maybe this is top confidential yet to talk about, but maybe you have something to relieve or to release with us today, or to announce with us today about Uber future in the region, if there is any. Otherwise, we will consider it as confidential information.
Well, there is a lot of things that are certainly confidential, but I think we're looking at what are the trends and what are the customers needing, right? Coming back to that point. And I believe big topics for us at the moment is hygiene. Big topic for us is how can we protect our drivers in order to have a safe work environment? How can we protect our customers in order to also be ready in case should there be a second wave coming, which depending on the region might be more likely, might be less likely. I believe also, certain things like Uber by the hour is something that we believe will stay longer in the market, but there might be certain elements that might be tweaked on that product in order to fit.
Cross borders with the healthcare industry with the Uber new thinking or new ways of thinking. Mark, do you see more tech giants will be joining the conversation by extending their support to the medical professionals?
Absolutely. I mean, I see, daily, I see the changes coming. You see announcements from Amazon, you see announcements from everybody jumping into the healthcare sector, whether it's the telecoms or the tech players themselves, but they all have initiatives for healthcare. And that's why I think there's a fantastic opportunity for the MENA, because many of them are unfamiliar how to, firstly, to access, but also to deal with the key players and the policymakers in terms of dealing with the cultural experience and whatnot. But I think I'm getting approached on a daily basis by people who actually want to do business in the MENA and in the GCC for certain. And I mean,
one of them, do you think it will be a game changer?
Which part of it? I mean,
which one of the announcement? Which one in the healthcare definitely? But I mean, if we hear Amazon today is going as a giant player in the world, is going, or they have an interest in the healthcare sector, how do you think someone like a big player like Amazon will be a game changer over the healthcare sector?
Well, it's to answer that in two parts. The mandate is actually called the patient end-to-end experience, and this is what Saudi and the Emirates are talking about, the end-to-end experience from birth to the end of your life, right? Which is fantastic, right? So that means doing genome sequencing from the time you're born to extend your life expectancy, all that. Fantastic. And so there's all kinds of aspects to look at for that side. In terms of the tech side, my favorite by far would be Elon Musk. I would love, we're talking to Singularity University in San Francisco about doing something together. I would suggest anyone look at them because they're doing some fantastic stuff on the biotech side and AI, of course. But in terms of Amazon's already got their hands into it. So there's no doubt all the tech players are getting into the healthcare sector. But in terms of what my favorite would be by far would be Elon Musk. I'm a great fan of what he's doing, and SpaceX and space medicine, another trillion dollar industry. Don't even get me started about that one.
Yeah. What about you, Caroline? What do you think? Are we going to see giant tech companies jumping into A, the healthcare sector, B, the logistics and transport sector?
Well, I think on the healthcare, like gradually and partially they are, and we have to face the reality that governments have less funds available than a lot of the tech companies. It is great to see if it goes into the right sectors, I guess the healthcare sector. I don't have a particular favorite, but I did think, one of the interesting elements was like when Amazon announced that they now having their own testing facilities, the willingness to take that responsibility on themselves for their employees, I thought was a very interesting approach, and potentially maybe also not only one for, from a resource perspective, but maybe actually one of getting a foot into the door of the healthcare sector. Might have been a very strategic move in order to kind of get started there.
Yeah, very true.
My last question for both of you, since you are experts in the healthcare and the logistics, transportation, what is the best advice you can give the people who is living in our region? They are willing to do business within the same sectors which you are in. What is the best advice you can give it to them, especially taking into consideration the what happened in the COVID, what is after COVID, and the new era of business? I'll start with ladies first. Caroline?
I believe to be agile and to try new things and to bring that with you also after COVID. And it sounds like a very standard way, and we read it very often, but it's really try, fail, and then try again, instead of making too many strategic plans and getting held up too long for getting into the last detail, because a lot of the things you will only know once you tried it. And in the meantime, you brought the learnings and you can adopt the product for taking it forward.
You think it's the best time now to start a new business in the logistics or transportation?
I believe generally technology strives in difficult environments. So when we look at how many tech companies were created in or after the last crisis,
that's right.
We see a trend that now is the time to do it and give it a try and adjust to the new reality and bring the tech segment with you.
Mark, any good advice in the healthcare?
I feel we're going from, in human history, I feel we're going from a period of just surviving to a future of thriving. I really do. So to say, I think people are open to new ideas. We have the attention of the GCC leaders, the full support of them under Vision 2030. We have the government agencies, the healthcare agencies. We have the funding, and most importantly, we have the willingness of the people. So I think partnerships and collaborations are a fantastic opportunity. And I think, people in the Gulf should look at telemedicine, digital health as a great opportunity for the future, for life expectancy at the very least. I mean, we have an opportunity to add 20 to 30 years onto, the average person's life.
We'll have another 20 or 30 years of a good potential, good business within the healthcare. For everyone who wants to establish a new business, they should start looking at healthcare in specific, especially after what we have seen over the COVID and how all the communities, all the countries in the world were not really ready for emergencies like a total lockdown or a total pandemic like what we have seen in the COVID. So I believe there is a huge opportunity for all of us to go back to basics and start focusing on what makes a country, what makes a living, the basics of healthcare, the basics of transportation, the basics of food supply, the basics of supply chain. So all of these, I believe, it has a brilliant opportunity. I will leave the mic for you, Caroline, if you want to end with any good statement for the audience.
No, I'm very thankful. It was a very, very interesting discussion, and I feel there's a lot more to talk about, the overlaps between the healthcare sector, the transport sector, the tech sector, overlapping between that, and the opportunities that are coming out of COVID. So very thankful to have met Mark as well.
Yeah, Caroline. And I think Caroline was absolutely right. I mean, the thing is, this is the opportunity. She hit a good point there, which is a lot of great businesses took off in 2008, the crisis is then, and launched then. And in the healthcare space, the digital healthcare space is phenomenal. If you have a good idea, launch it now. I mean, the thing is, there's only upside from here. There really is. So, I mean, there's going to be consolidation amongst the industry, but at the same time we're talking a $12 trillion industry. So
Mr. Mark Nichols, you are the head of Strategic Initiative for the MENA region in the World Health Innovation Summit. I would like to thank you very much for being with us today and accepting the invitation to be on Entourage Talks and supporting us with all your knowledge and information about the healthcare. Ms. Caroline, you are the head of business development, MEA and Pakistan of Uber. As well, I would like to thank you very much for accepting the invitation and to be with us here on Entourage Talks today, giving us a lot of your knowledge, especially in your field and industry within the logistics and transport, especially within the region.
Thank you.
Thank you very much as well for my audience who've been with us live over the Entourage Talks for the past few episodes. Looking forward to meet you very soon and to see you again with another interesting topic with an excellent and experts from different industries. Until then, please stay safe and take care of yourself. Thank you very much. And
thank you, Mohammed.
Thank you very much. Thank you.
Thank you.